Chemotherapy. It's a word that can bring about a lot of fear. But what exactly is chemotherapy? Chemotherapy, often simply called chemo, is a type of cancer treatment that uses powerful drugs to combat various types of cancer. It's one of the most common treatments available and can be used on its own or in combination with other treatments like radiation therapy, surgery, or other drug therapies. Chemotherapy works by targeting rapidly dividing cancer cells, but it can also affect healthy cells, which is why it may cause side effects. These side effects can vary from person to person and can be short-term or long-term. How does chemotherapy work? In your body, cells naturally grow and multiply. Each cell makes a copy of its DNA and then splits into two new cells. This is called the cell cycle. Cells only multiply at certain times, and they die when they get old. This is normal and healthy. But sometimes the process gets disrupted, causing cells to multiply too quickly. This results in cancer. Chemotherapy targets these fast-growing cancer cells. The drugs kill these cells or at least stop them from multiplying. They do this by interrupting certain parts of the cell cycle. Each chemotherapy drug works differently. For example, some drugs stop DNA from copying itself so that cancer cells can't multiply. Unlike radiation or surgery, which target specific areas, chemo can work throughout your body. It kills cancer cells, but it can also affect some fast-growing healthy cells, like those of the skin, hair, intestines, mouth, and bone marrow. That's what causes some of the side effects from the treatment. You might get just one chemotherapy drug or a combination of them. Using a combination can make your treatment more effective because each drug attacks cancer in a different way. It also lowers the chances that your body will learn to resist a drug. Resistance means that the drug doesn't work for you anymore. There isn't one best type of chemotherapy drug. Which drug will work best for you depends on many different things. You and your doctor will choose which drugs to use based on the type and subtype of cancer, the stage of the cancer, how far it has spread, results of other tests on the tumor such as biomarkers, the patient's age, the patient's overall health and current medications, other serious health problems such as heart, liver, or kidney diseases, types of cancer treatments given in the past. Treatment goal. Chemotherapy is a powerful tool in the fight against cancer and can be applied in various ways depending on the stage and type of cancer. Firstly, we have curative therapy. This is when chemotherapy is used as the main treatment to cure cancer. While the ultimate goal is to eradicate cancer cells completely, achieving a cure can be a long and uncertain process. In some cases, chemotherapy can destroy cancer cells to the point where they are no longer detectable. The hope is that they never grow back, but this outcome is not always guaranteed. Next, we have neoadjuvant therapy. This approach involves using chemotherapy to shrink a tumor before other treatments, such as surgery or radiation, are employed. By reducing the size of the tumor, these subsequent treatments can be more effective. Chemoradiation is another important use of chemotherapy. Here, chemotherapy is given alongside radiotherapy to enhance its effectiveness. The combination helps to make the radiotherapy work better at destroying cancer cells. For patients with advanced cancer, we have palliative therapy. When the cancer is advanced, likely uncontrollable, and has spread, the goal of chemotherapy is to improve the quality of life. It helps to alleviate symptoms, such as pain or pressure caused by tumors, thereby making the patient feel better and more comfortable. If a cure is not possible, the goal shifts to controlling the disease. Chemotherapy in these cases aims to shrink tumors and stop the cancer from growing and spreading. This approach helps patients feel better and live longer. While the cancer might not completely disappear, it can be managed as a chronic condition similar to heart disease or diabetes. In some cases, the cancer may go into remission for a while but may return later. There are several ways chemotherapy can be given, depending on the type and location of the cancer, as well as other factors. Let's explore these methods in detail. Intravenous IV chemotherapy is the most common form of chemotherapy. In this method, chemotherapy drugs are delivered directly into a vein. This can be done through a tube in your arm or a device implanted in your chest. This method allows the drugs to quickly enter your bloodstream and start working against the cancer cells. Injection. In some cases, chemotherapy drugs are delivered via injection. This can be done directly into a muscle in your hip, thigh, or arm, or into the fatty part of your arm, leg, or stomach just beneath the skin. Creams. For certain types of skin cancer, chemotherapy drugs can be applied topically as a cream or gel. This method allows the drug to target cancer cells directly on the skin. Pills. Chemotherapy can also be taken orally in the form of pills, capsules, or liquid. This method is convenient and allows patients to take their medication at home. Intraarterial chemotherapy involves delivering drugs directly into the artery that is feeding the cancer. This can be done through a needle or a soft, thin tube called a catheter. This method helps to target the cancer more precisely and reduce the impact on the rest of the body. Intraperitoneal. This method involves delivering chemotherapy drugs to the peritoneal cavity, which contains organs such as the liver, intestines, stomach, and ovaries. It can be done during surgery or through a tube with a special port that is implanted by your doctor. Intrathoracic. In this method, chemotherapy is delivered directly to the chest, specifically to the pleural cavity, which is the space between the two layers of tissue covering the lungs. This is used to treat cancer cells that have spread to this area. Intrathecal chemotherapy involves injecting the drugs into the cerebrospinal fluid, which surrounds the spinal cord and brain. This is done using a needle or a long-term catheter and port. It is particularly useful for treating certain types of brain cancers. Intravesical chemotherapy is delivered directly to the bladder through the urethra. A doctor will insert a soft, thin catheter through your urethra, leave it in for a few hours during each treatment session, and then remove it. This method is often used for bladder cancer. Intralesional. In cases where the tumor is accessible, chemotherapy drugs can be injected directly into the tumor. This method helps to target the cancer cells directly and minimize the effect on surrounding healthy tissues. Surgical. In some situations, chemotherapy can be delivered directly to the tumor site during surgery. The doctor will place a thin wafer near the tumor, which contains chemotherapy drugs. As the wafer breaks down, it releases the drugs directly to the tumor area. This method can also be used in the space where a tumor was surgically removed. Chemotherapy and its potential side effects. Chemotherapy is a powerful treatment used to target and destroy cancer cells. However, it can also affect fast-growing healthy cells, leading to various side effects. This is because chemotherapy doesn't discriminate between cancer cells and other fast-growing cells in your body. While healthy cells can usually recover from the damage caused by chemotherapy, cancer cells cannot, and they eventually die. It's important to understand that everyone responds to chemotherapy differently. Your doctor may predict which side effects you might experience, but the true impact will only be known once you start treatment. Some people have mild side effects or none at all, while others may experience more severe reactions. Factors such as your overall health and any other medications you take can influence your experience. Let's go through some common side effects. Hair loss. Chemotherapy can damage hair follicles, leading to hair loss. This can affect not just the hair on your head but also eyebrows, eyelashes, and body hair. The extent of hair loss varies from person to person, even among those taking the same drug. Nausea and vomiting. These are common side effects that can often be managed with medication. Diarrhea, characterized by frequent watery stools. Constipation, difficulty in passing stools. A loss of appetite. Chemotherapy can make you feel less hungry. Weight loss, due to a lack of appetite and other factors. Mouth sores. A chemotherapy can cause sores in the mouth and changes in taste buds, making eating less enjoyable. It's important to ensure your mouth is healthy before starting treatment to avoid additional dental problems. Fatigue, a common side effect that can vary in severity. Mood changes. You might experience mood swings or feelings of depression or anxiety. Fever. It indicates an infection, which requires immediate medical attention. A neuropathy. A numbness, tingling, or pain, usually in the hands and feet. Dry skin. Your skin might become dry and irritated. Changes in skin and nail color. You might notice discoloration. Kidney and bladder problems. Chemotherapy can affect these organs, requiring regular monitoring. A libido changes. You may experience a decrease in sexual desire. Easy bruising and bleeding, due to a lower count of platelets which help in blood clotting. Anemia, low levels of red blood cells, leading to fatigue and weakness. Neutropenia, abnormal low count of neutrophils, a type of white blood cell, increasing infection risk. Infection, a weakened immune system makes you more susceptible to infections. It's essential to communicate openly with your healthcare team about any side effects you experience. Doctors can help prevent or treat many of these side effects. If necessary, they can even adjust your treatment to avoid certain side effects. Side effects usually go away soon after chemotherapy ends. They can provide medications and strategies to help manage these symptoms, making your treatment journey as comfortable as possible. Remember, your doctor is your partner in this process, and together you can navigate the challenges of chemotherapy. Understanding the length of chemotherapy treatment. Chemotherapy treatment duration varies based on several factors, including the type of chemotherapy administered. Here's an in-depth look at what influences the length and frequency of chemotherapy treatments. Duration of a single chemotherapy session. The length of a single chemotherapy session can vary significantly. Short sessions. These may last from a few minutes to a few hours. The continuous infusions. Some treatments require continuous infusions powered by an electronic pump, which can extend over multiple days. Multiple rounds of chemotherapy. Most chemotherapy regimens involve multiple rounds of treatment. Here's what you need to know. A single round. This can span several days or weeks, followed by a break period. Recovery time. The break allows the body to recover from the effects of chemotherapy. Subsequent rounds. After recovery, another round of chemotherapy may follow, continuing the on-off pattern. Factors influencing chemotherapy schedule. The specific schedule for chemotherapy treatment is personalized and depends on several factors. A type of cancer. Different cancers may require different chemotherapy approaches. A stage of cancer. The advancement of the cancer affects the treatment plan. A treatment goal. Whether the aim is to cure the cancer, control its growth, or ease symptoms and pain, this will influence the treatment duration and frequency. A type of chemotherapy. Different chemotherapeutic agents and protocols have varying schedules. The body's response. Individual reactions to treatment play a crucial role in determining the schedule. Understanding these factors can help patients and caregivers prepare for the journey ahead. I want to address an important question that many patients and their families often ask. Can cancer come back after chemotherapy? Cancer can indeed come back after chemotherapy or any type of cancer treatment. This recurrence can happen because some cancer cells may survive the treatment and grow again over time. Once your treatment ends, your care team will usually ask you to come for follow-up visits. These visits are crucial to monitor for any signs of the disease returning and to catch it early if it does. Let's talk about how to prepare for chemotherapy. Chemotherapy is a powerful but intense treatment, and there are a few steps you might need to take before it starts to ensure you're ready both physically and mentally. It's essential to talk to your doctor. Ask them what to expect from the treatment. This conversation can help you mentally prepare and make necessary plans. Here are a few questions you might consider asking. What are the potential side effects? How long will each session take? Are there any specific foods or activities I should avoid? What steps should I take if I experience severe side effects? By having a clear understanding of the treatment process, you can reduce anxiety and feel more in control. Chemotherapy is a versatile and essential part of cancer treatment, offering hope and relief in many forms. Understanding its different uses helps patients and their families navigate their journey with cancer more effectively. Before starting any cancer treatment, including chemotherapy, it's important to have an open and honest conversation with your healthcare provider. Discuss the potential risks and benefits, and don't hesitate to ask any questions you might have. By understanding chemotherapy and working closely with your healthcare team, you can make informed decisions about your treatment. Chemotherapy can be challenging, but with the right preparation and support, you can navigate it successfully. Stay informed, stay strong, and remember, we're here to support you every step of the way. Thank you for watching, and stay tuned for more educational content on cancer treatment and awareness.